Multnomah County Commissioners just banned the distribution of needles within 1,000 feet of schools, something that state lawmakers tried and failed to pass this last legislative session. This is a story that our Fox 12 anchor Pete Ferryman brought you last year. Fox 12 investigative reporter Spencer Schott picks up our coverage. He listened in on today's discussion and explains why this proposal has been so controversial.
Because this ordinance deals with two different groups of vulnerable people, children and those suffering from substance abuse disorder, listening in on today's commissioners' meeting, officials didn't want to come across as favoring one group over the other. The ordinance passed Thursday will prohibit syringe service programs from setting up temporary needle distributions within 1,000 feet of any school in Multnomah County. Fox 12 Investigates has been following the face-off between these harm reduction groups and parents who say these needle handouts are putting children in danger, partially because they've seen an increased number of needles left behind in parks and along sidewalks. During Oregon's last legislative session, Senate Bill 1573 was introduced to ban syringe service programs from setting up within 2,000 feet of a school, but it was killed in committee after lawmakers could not agree on how to enforce the bill. Multnomah County Commissioners say the county-level ordinance is based on SB 1573, and during Thursday's public comment period, while everyone who spoke out supported the ban, many said it doesn't go far enough.
The ordinance creates an enforcement pathway, but it remains largely complaint-driven. Over the last couple of years, we've served as the primary documentation system.
Establishing a 1,000-foot safety zone around K-12 schools, effectively banning mobile syringe services within that radius, is the least you can do.
My main concern kind of with this one is that we're only focusing on syringes, but I really feel like handing out the drug paraphernalia and then not implementing any kind of drug addiction treatment, documentation, pamphlets, getting these people help.
Another concern I heard was this ordinance will sunset in 2028. The commissioners say this is because they believe this is something the state should be handling rather than the county. So they're hopeful a version of SB 1573 will pass at the state level. The county's version goes into effect August 24th. Reporting in studio, Spencer Schott, Fox 12 Oregon.